Just last week, the government of Namibia, working closely with Unicef, the World Health Organization, different partners including civil society, joined the world to launch, yet again, a renewed promise to the children of Namibia. And that was the child survival strategy. But what was critical about this launch of a promise renewed for child survival was that Namibia complemented this desire to accelerate child survival by also launching the country implementation plan for improved nutrition. And this is for scaling up nutrition. As a lead country, Namibia has to reduce stunting, the current levels of stunting, which stand at 1 in 3 children being stunted at the under 5 age. Participating at this launch were certainly senior government officials, development partners, civil society organizations, the academia, the media, and importantly, the Prime Minister was represented by the National Planning Commission, the Director General, Dr. Tom Alwendo. Our regional director, Leila Pakala, was represented also by Mark Hewitt, our Deputy Regional Director. Despite progress already made in child survival in Namibia, we are still seeing reversals in the gains made by independence. It is happening in an environment where 56% of our citizens in Namibia still practice, for example, open defecation. And this is unacceptable in a country that is declared an upper middle income country. We have numbers of as high as 70% that still practice open defecation in rural communities. Child poverty is alarming at 18% of children who still live in severe poverty. But there is good news. The child survival strategy, the scaling up nutrition country implementation plan, the efforts by the government of Namibia aim to reverse this whole situation. And this is why we in Namibia see the launch of a promise renewed for child survival as an opportunity to use our comparative advantage and do things better, with little resources for optimal results for children. For us in Namibia, a promise renewed actually calls for child survival strategy that aims to reduce under 5 mortality from 54 in 2013 to 39 by 2015. And to 24 by 2018 and below 20 by 2035. Renewing the promise for child survival is not an option not to do in Namibia, and the government of Namibia has just demonstrated that commitment. We have launched and we will be implementing together.